fatigue, poop, nausea, weight loss, poop. I know all about that stuff. Why? That was my life for 7 years. Today, I will talk to you about ulcerative colitis. I will be talking about diagnosing ulcerative colitis, the treatment for it, and the psychological effects of the disease. So, what is ulcerative colitis? The Crohn's and Colitis Foundation of America describes it as a chronic disease of the large intestine, which is also called the colon. And the lining of the colon becomes inflamed and develops small sores or ulcers. Now, Medscape.com says that this inflammation can cause nausea, poor appetite, joint pain, skin sores, fatigue, anemia, and frequent fevers. I started noticing all those symptoms in my early 20s. Within 2 years, things like an upset stomach when I ate and trips to the bathroom became an uncontrollable way of life for me. I wasn't able to eat, I would get very tired, I would have joint pain, and I would get frequent eye infections. A colonoscopy determined that I had ulcerative colitis. I finally had a reason for why I was feeling so awful. What can be done for a person with ulcerative colitis? This is a chronic illness that can go into remission for months or even years, but eventually the symptoms always return. The New York Times website states that the goals of treatment are to control the acute attacks, prevent repeated attacks, and help the colon heal so it looks just like this. And hospitalization is often needed for severe attacks. That website also goes on to say that 25 to 40% of patients with ulcerative colitis eventually need surgery. Many people say, oh, just watch what you eat, you'll be fine. Well, diet does not cause ulcerative colitis. However, foods such as dairy, things with too much fiber, fatty foods, that can trigger the symptoms. Because my symptoms were so out of control, my doctor put me on medication in a strong dosage of prednisone, which is a steroid. And this only provided some relief. As time went on, my periods of remission were few and far between. I can really relate to Amy Brenneman. She's the star of the TV show Private Practice. She had an interview with Prevention Magazine. And in that interview, she was quoted as saying, "Everything I did had some small benefit, but nothing really solved the problem. I remember thinking, this is just taking up too much of my space." Wow, that is exactly how I felt. Everything I did centered around the disease and the symptoms, and it got to the point where I had diarrhea on average of 35 to 40 times a day. So the doctor determined that I should have surgery. And this surgery was called the J-pouch surgery. In this surgery, they take out the large intestine, the rectum, pull down the small intestine and make the bottom part of it into the letter J. And that bottom part of the J is attached to the anal canal. That's why it's called the J-pouch surgery. I know it sounds gross, but it changed my life. And I no longer am at risk for colon cancer, and I no longer have to take medication. How does a person even deal with this disease? How do they even handle it? Well, it's very hard for the patient. And Medscape Education did an assessment that found that it affects a patient's ability for productivity at work. It affects their relationships. It causes a fear of incontinence and embarrassment. And it also affects their families in ways such as their daily routines, their financial decisions, their careers, their relationships. Well, of course, the disease affected me as well. It caused me to be so embarrassed for the way the medicine caused me to look. for how it made me feel. I was embarrassed around my husband, my family, my friends. And I was feeling awful and so alone, like nobody was going through it except me. My son was a preschooler at the time, and his way of dealing with the disease and the sickness was to nervously chew on everything from sofa cushions to his baseball mitt. That, of course, made me feel like a horrible mom. So not only was I physically hurting, but I was mentally hurting. Today I shared with you what ulcerative colitis is, the symptoms, the treatment, and the psychological effects of the disease. Is there life after ulcerative colitis? What about that pain and the nausea and the poop that I mentioned in the beginning? Well, okay, occasionally I still have it. But where once the disease had total control of my life, I am now able to have the control